Hi, this is Dr. Anton. Today's video is going to be about going back to school. Today is the 28th of May, and on the 1st of June in South Africa, the grade 7s and the grade 12s are supposed to go back to school. I'm very aware of the fact that some parents are deeply concerned about sending their children back to school for their children's well-being, their own well-being, and potentially for older people that live in the homes where the kids are going to come back to. So in this video, I'm going to explain to you why I'm not concerned about sending my kids to school, why I actually would like to send all three of my kids back to school if I could, and why I believe you shouldn't be concerned either. But before I continue, I'm going to follow a slightly different angle with this video. Due to this happening to me quite a bit at the moment on certain platforms, I'm going to not use certain words in this video to see if I can escape this thing. So apparently some of the words that I'm using are not good, especially this one. So I'll be using some of these flashcards as I go along through this video. Now that you understand my code language, we need to just discuss if this particular condition really is killing children. And the short answer to that, and I think many of you have heard this, is no, it does not. The normal flu season just in France has already killed more children this year than what this has done the entire season in the entire Europe. So we know for a fact that this condition doesn't favor children, and children actually have very mild illness. They have very low viral load. This is very important because viral load is a determinant of your ability to infect others, and we're going to chat about that just now. So that's the first point I want to make, is that this condition does not kill as many children as a normal seasonal flu. The CDC in the USA have echoed this, where they've now analyzed 2,500 cases in children that have the virus, and they've just said that, number one, the children, they don't get severe infection. They are in many cases completely asymptomatic, and it would appear that they're not even giving each other the infection as easily, and they're not giving the infection to their parents that easily. If you look at this slide, this is from the Netherlands National Institute for Public Health and the Environment, where they did a study to see how children are transmitting the infection. And I know it looks a bit confusing, but what this is basically saying is that this infection is spreading with adults giving it to their peer groups, to the same age. Very few children are giving it to each other, and very few children are actually giving it to adults. It's actually the reverse. Some adults are giving it to the kids, but also that doesn't even work that well, because the children just don't pick up this infection that easily or show signs that they have it. To then just echo this whole sentiment further, is that Dr. Daniel Koch, he's head of infectious disease in Switzerland, has now said officially that they're going to allow children to hug their grandparents. And there are many stories that highlight this whole issue. There's the story of a 9-year-old child in the French Alps that was infected with the virus, and this child was in contact with 170 people, and none of those people actually contracted the virus. So I will provide you a link in the description to the Netherlands National Institute for Public Health, where they describe their study in more detail and the measures that they are taking. The other concern that parents are now discussing with me is the whole concept of this new condition that has been discovered in relation to the virus. And it's a Kawasaki-like disease. Now, let me just stop here and just say something about Kawasaki's disease. Most doctors in their entire career will never see a single Kawasaki syndrome patient. Kawasaki, and I'll put up a few studies on the screen now, and I'll put the links in the description below. So Kawasaki is a vasculitis that happens after a viral infection. The prevalence is very low, and the prevalence of this new condition is as low. So children get Kawasaki's disease or Kawasaki syndrome after a viral infection, but they can also get it after vaccination. The prevalence is still very low, and it's usually in children that are younger than the age of 5. So here you see the new syndrome that's being described. It is called MIS-C, Multisystem Inflammatory Syndrome in children. It happens in older children, so Kawasaki, children less than 5 years of age. This one, the average age was about 10 years. And the children present with prolonged high temperature, with skin rashes, abdominal pain, diarrhea, very similar symptoms than with Kawasaki. But the type of symptoms that means I must take my child to the hospital. And in this particular study, they had a look at 35 children that all recovered very nicely. Some of the children had edema of the heart muscle, so it was necessary to have them admitted to hospital. But here's the take-home message. All of them recovered rapidly. There's an existing treatment protocol for Kawasaki that works for MIS-C. And all the children recovered completely, and they had no deaths. And so here's the issue. Professor Russell Viner from the Royal College of Pediatrics have described about 250, he describes about 250 children that they know of in Europe that have had this condition and that have recovered. All of them recovered. But that's 250 cases out of the entire Europe. That's millions of people, which just shows you how low the prevalence really is. And this is maybe why I want to just take a moment out of this video to speak about the levels of fear that is going around at the moment. Here we have a condition, Kawasaki or Kawasaki-like illness, that most doctors will never see in their careers. And now parents are worried about this thing because it's being thrown on social media or wherever we are seeing all these things. And I think it's time that we as a society start pushing back in how we speak about these things, what we say to our family members, what we say to our friends, what we say to our children. If I look at tuberculosis, tuberculosis kills 1.6 million people per year. 1.6 million, that's every year. That's a person every 20 seconds. And if I really wanted to, I can make you scared of TB now, because TB is also an aerosol. This thing is heavy micro droplets. So TB, the aerosol of TB spreads much faster. And if I stop myself in this video every 20 seconds and say, oh, just hold on a moment, someone's just died of TB, I can make you scared. So maybe we should start just changing the way that we speak. When we speak about this condition, and when we say, you know what, we now know of 20,000 or 24,000 cases are now officially reported. How about 24,000 people are helping us to get closer to herd immunity, and 24,000 people have got lifelong immunity, and we are going to get there. So I think it's important that all of us start changing the way we speak, and that we push against this fear that is gripping us as a society, because I really don't feel that we should be scared of this, because as a society we are going to reach the place of herd immunity, and our children will be fine when they go to school. Maybe just a note to the teachers before I go into more detailed treatment protocols. Obviously now, if you've now heard the first part of the video, you'll understand that it's more of a risk that you are going to give this particular virus to the children. So the kids, we now know the kids are not even going to give it to each other. They're not going to give it to you, the teacher. But even you, the teacher, you're sitting with the most resilient part of the population in your class. So even it's not even technically a risk that you are going to give it to the kids. So I just wanted to put that out there for the teachers as well. I don't want to completely duplicate what I said in my Supercharge Your Immune System video, so I'm going to put a link in the description below. But specifically, just to be quick, I'm going to just give you my protocol that I advise for children and also for teachers and for parents, because I mean your kids are obviously going to come back to you after school. So here's the protocol over here. As you can see, the first one's very important, but particularly the third. Okay, now that was just a little doctor joke there. I'll put up some slides and show you exactly what I would like you to do. But this one over here is called sevotamic acid. That's the official other chemical name. So apparently I have to stay away from using this horrible word. So when you see sevotamic acid, you know what it means. Okay, the first part of the protocol is very important, and that is the things that we do every day that is actually going to boost our immune systems. This is for the children, for the parents, and for the teachers. Sleep enough, daily sunlight exposure, make sure that you stay hydrated, limit bovine dairy. I like to limit bovine dairy because it increases mucus production in your airways, and limit sugar intake in your diet. Okay, so here's my protocol for children 2 to 4 years of age. Just remember that you must subject anything I say in this video to your regular healthcare provider, because I cannot predict what conditions are present in the families that I'm speaking to now. But there you see the sevotamic acid. In this case, it's a chew tablet. You know what sevotamic acid is now. And then I like to give my kids a good multi-nutrient that contains zinc. Zinc is very important. And there must also be selenium, preferably in the multi-nutrient. There you see the omega-3s. Omega-3s help with white blood cell functioning. Very important. Vitamin D, paramount. Adults, children, all ages. Helps the immune system just to function so much better. There's quite a lot of research in the Northern Hemisphere countries on the importance of vitamin D, especially in winter. And then the Rockstar probiotic. Remember now, 70 to 80% of your immune tissues are in the wall of your intestine, and the probiotic bacteria act as triggers for that. This is the protocol for 4 to 12. So it's all the same things on the list here. You just see the dosages slightly different. And here's the protocol for the adults. Once again, the same things, but I really would like you to go and look at my Supercharge Your Immune System video. Just look at the link in the description where I explain why I add quercetin for some patients. I would like to end off this video by just reminding you that there are doctors that are being successful in treating this condition. I'm going to put a list on the screen here. As you can see, they come from many universities in the United States, as you can see on the list there, and their success rate and their documented success rate in treating this particular condition is exemplary. They've done so well, and they've put together how they do it in an easy to use protocol. It's downloadable from this website. So my advice to you would be to download this protocol. Step 1, give a copy to your doctor, your GP. If you know the specialist at the hospital that you may get admitted to, should you get very ill, send a copy to him so long. It's free to download that protocol, but it's been tried and tested. And in South Africa, we're only going to winter now. So our doctors can do with advice from the doctors that have already successfully treated this condition. I trust this video was useful and that it helped you to formulate your own decision on what you want to do with your children going back to school. I know that there are some parents that have tasted homeschooling and they feel that maybe this is for them and maybe they'll never send their kids back to school. And I spoke to a parent the other day who said that her one child is actually scholastically doing much better. But this is a decision that you have to make as a family. But I trust that you can use the content of this video to help you to make that decision. This is Dr. Anton. Thanks for watching.